Policing and Mental Health Crisis in the United States by Jordan Madison. In cities across the United States, police are often the first responders to mental health crisis. But is law enforcement the right tool for the job? Today we're going to explore the complex intersection of policing and mental health and what happens when the systems fail to align. Area of the problem. Each year, nearly 1 in 5 adults in the United States experience a mental health illness, and around 1 in 10 police calls involve someone with a mental health crisis. Police officers often serve as a default first responder to mental health crisis. This role places them in challenging situations for which they may not have adequate training, leading to potential escalation. In cases where the individual isn't fatally injured, it can tend to lead to the criminalization of mental illness. A case more local involving the death of Daniel Prude in Rochester, New York, whose death during a mental health crisis response underlines systematic failures. Incidents like these have sparked national conversation about the need for reform in handling mental health emergencies. The challenge? Police officers are not trained for the mental health professionals. They they are often forced to make split-second decisions in high-stress situations, which can lead to tragic outcomes. Over the past few decades, the U.S. has largely defunded public health institutions, leading to law enforcement to fill the gaps. Cook County Jail in Chicago and LA County Jail and thousands of people house thousands of people with untreated psychiatric conditions. It is a jail that is being doubled as a psychiatric ward, however, with less tools and less trained personnel. The New York State Bar Association states that more than 70% of people in the U.S. jails and prisons have at least one diagnosed mental illness or substance abuse disorder, or even both. Many cities lack alternative crisis response units, like social workers or mental health crisis teams that can be dispatched instead of police. The issue isn't just about the individual police officers, it's the overall structural failure. Real world examples and consequences. If you take the case of Daniel Prude, a 41-year-old black man was experiencing a mental health crisis. His sister-in-law called 911 for help. When police officers arrived, Prude was naked, unarmed, and compliant, laying on the outdoor ground with snow falling. The officers placed a spit hood over his head, held him face down to the pavement for over 2 minutes, and he lost consciousness, was taken to the hospital, and died. His cause of death was complications of asphyxia in the setting of his physical restraintment. Manner: homicide. Consequences led to calls for non-police mental health crisis teams, specifically in Rochester, and public outrage and protest also erupted. The body cam footage is below, but is a little gruesome, so I would say more than a little. Viewers' discretion advised. I'm just not going to play it for courtesy reasons. But Walter Wallace Jr. Walter Wallace Jr., a 27-year-old black man, was having a mental health episode at home. Family members called 911 requesting for medical help. Wallace was holding a knife and reportedly was walking towards the officers. Despite his mother's pleas and the obvious signs of mental health crisis, officers shot approximately 14 rounds and 10 bullets hit and killed him within a few seconds of arrival. The family had asked for an ambulance, not the police, due to Wallace Jr. being medicated for bipolar disorder. The consequences? It sparked wide protests in Philadelphia and beyond, and highlighted the lack of crisis intervention training and non-deadly de-escalation strategies. The body cam video is also below, but viewer discretion is advised. What is being done, or what could be done? All across the country, cities are plotting new solutions. Some of the solutions have been the Mobile Crisis Response Team. This team includes mental health professionals who respond directly to crises, often without police. Mobile crisis units operate in some cities and can be dispatched through 911 or mental health hotline. Cahoots. Cahoots is a 30-plus-year-old program where medics and mental health workers respond to 911 calls, no police involved. It has an annual budget of about 2 million and has saved the city 14 million yearly in ambulance trips and emergency room cost and approximately 8.5 million in public safety. And what could be done? The decriminalization of mental health, reform laws that criminalize behaviors that linked to psychiatric conditions such as public disturbance, expand non-police crisis response nationwide, fund trained mental health professionals, not just police. Programs should be scaled to every city as well, not just the ones that are having them currently. In conclusion, the mental health crisis in the United States is real, and how we as a community and society respond matter. Police should not have the extra stress of being the default group of who assesses the mental health crisis. For one reason, they are not trained for these situations. Communities need mental health cares that provide safety, dignity, and support. Thoughts of suicide, mental health crisis, substance crisis, or any other mental health concern, please don't be afraid to reach out to the Suicide in Crisis Lifeline at, you can text or call 988. And also a link below is for their website as well. Thank you.